Well, hey there, future nurses. Welcome back to Med Monday. So let's go ahead and get started. So today our medication is sertraline or Zoloft as the trade name. The functional class is antidepressant. The chemical class is SSRI. And this medication is given PO or orally. Now, this medication inhibits serotonin reuptake in the CNS. It increases the action of serotonin, but it does not affect dopamine or norepinephrine. So, what is the indication for this medication? Why do we give it? So, this medication is given for major depressive disorder, obsessive compulsive disorders, post traumatic stress disorder, panic disorder, social anxiety disorder, and premenstrual syndrome or premenstrual dysphoric disorder. So, our contraindications, or why we don't give this medication, include hypersensitivity, but we can give this precautiously in patients with renal and hepatic disease because we're watching for clearance, patients who are pregnant or breastfeeding. We want to monitor our geriatric patients, again, because of clearance, patients with recent MI, patients with latex sensitivity, and patients with epilepsy because it can cause seizures. So, side effects for this medication, there are lots of side effects, but I'm only going to cover what I think are really the important ones. So, tremors, ataxia, which is lack of muscle tone or coordination of volunteer movements, and that will affect your gait. So you'll have gait abnormality. So our patient is at risk for falls. SIADH, diabetes mellitus, dry mouth is very common. Male sexual dysfunction, so we want to make sure we discuss that with our male patients, and hyponatremia. So, adverse reactions, and these are things that are life threatening. So, CNS adverse reactions include seizures, neuroleptic malignant syndrome like reaction, serotonin syndrome, suicidal ideation, and GI issues include hepatitis, and miscellaneous is neonatal abstinence syndrome. Basically, that's fetal withdrawal syndrome. So, nursing considerations, things we need to think about while we're administering this medication and monitor for. So, it does have a black box warning for serotonin syndrome, and because it can increase suicidal ideation in all populations. So, this medication is given to adults and children. So, we want to make sure that we monitor them and discuss this with them. We want to monitor the renal and hepatic function, so we want to check those labs. We want to monitor our patients for signs and symptoms of bleeding. We want to make sure that it's not used with MAOIs. We want to monitor for mood changes, and we want to monitor again for serotonin syndrome and urinary retention. So, patient teaching includes letting them know that it may take up to 4 weeks for them to start to feel the effects of this medication. So, they need to be patient. That they need to use the medication cautiously when driving or performing other activities that require alertness. Blurred vision may occur, and we want to make sure that they don't discontinue the usage of this medication if they've been using it for a long period of time. We want to discuss that they could potentially have suicidal ideations, and that if they do, they need to contact their physician immediately. We want them to avoid alcohol. It does not need to be taken with food. We want to teach our patients and their family members the signs and symptoms of serotonin syndrome, and to notify the physician if they're pregnant or they intend to become pregnant. We want to teach them the signs and symptoms of bleeding. And before we get to our challenge question, I just want to add on there that we need to discuss with our patients the usage of over-the-counter medications and herbal medications because those can interact as well. So they should discuss with their pharmacist or their physician before they start taking those. So our challenge question for the week is: your client has been experiencing increased signs and symptoms of OCD despite daily dosage of Zoloft 25 milligrams PO. The physician has changed the prescription to 75 milligrams PO daily starting today. However, you administered the morning dose about an hour ago, so the physician adjusted the dose and ordered 50 milligrams PO now. The pharmacy only has 25 milligram tablets on hand. How many tablets will you administer? Make sure to put your answer in the comments, and we will choose a winner and let you know next week. So until next week, I want you to have a great Monday and keep working on your dream.